Okay guys, in this video we will discuss the function of the lung. So how the lung is work and how the air can enter our body and how we can exhale this air. So basically, as we mentioned before, the lung is responsible of something called the gas exchange, which is exchange of oxygen and carbon dioxide. And this process, as we mentioned before, it happened in the alveoli. So this is the alveoli, which is the last part of the lung. Before we discuss this process and how this happened, we should know the parts of the respiratory system. Okay, so here we have the parts of the respiratory system. As we see in this picture, we have the nose, we have the mouth. Also here we have the nasal cavity and we have the oral cavity. And here we have the part of the respiratory system. It's called the pharynx. So basically the pharynx is a muscular tube, which is the normal connection between the nasal cavity and the oral cavity. Also, this part is called the larynx. So the larynx also called the voice box, which is containing vocal cord. So it's responsible of producing our sounds. And here we have a part, it's called the epiglottis. Okay, so what is the function of the epiglottis? So the epiglottis, it prevents when we, for example, swallow any type of the foods, or for example we drinking any liquid, for example, then this epiglottis, it will move to the down and prevent the food, okay, or prevent the liquid from moving to the larynx, because here after the larynx we have something called the trachea, okay, and after a few minutes I will show you the trachea, and after the trachea we have the lungs. So if the food or liquid move to the larynx, it will go to the lung, okay. So and when we, for example, swallow this food or swallow any type of the liquid, okay, it will move firstly from the mouth and then move to the pharynx, okay, and then it will move to the esophagus, and from the esophagus it will move to the stomach, okay. But for example, when we inhale the air, okay, so when we inhale the air either by, for example, nose or by, for example, mouth, okay, this air, it will move to the pharynx, and then from the pharynx it will move to the larynx, and then to the trachea, and then to the lungs, okay. Okay guys, so here after the larynx basically located here. After the larynx we have the trachea. This tube, it's called the trachea, okay, and basically this trachea, it's containing this C shape. As we see this C shape, it's called the cartilage. This cartilage just protect the trachea, okay. Then we have this one is called the bronchi, the both of them bronchi, and then we have the smaller one is called basically the bronchioles, okay. This is the last part, the bronchioles. After the bronchioles, okay, in this parts, okay, the last part in the lung, we have the alveoli, okay. So before we move to the process how the air it move, okay, to the alveoli, we should know the part of the lung. So we have two parts of the lung, the right lung and the left lung, right? So what is the differences between both of them, right and left one? So the right side is containing three loops. This is the first loop, second loop, and third loop, while the left one is containing only two loops. This is the first loop and this is the second loop, okay. Why these differences happen, or why we have only two loops in the left side? Because in the left side here we have the lung, the heart, okay, so the heart is located here. Because of that, it's basically smaller than the right side, okay. So for example, if we swallow anything, okay, large foreign body, it most likely go to the right lung, not the left one, because basically the right lung, the bronchi of the right lung, is bigger than the left one, okay. Okay guys, so here we have the alveoli, which is, as I mentioned, it's the last part of the lung, and this is the bronchioles here, okay. So the alveoli here, the location of the gas exchange. So the gas exchange, it happened there. How this gas exchange is happen? So firstly, when we inhale the air, okay, we taking from the air the oxygen, okay. So this oxygen, it will enter to the alveoli here, okay, it will enter to the alveoli. And as I mentioned before, we have here the pulmonary artery, and we have the pulmonary vein, right? So as we know, the pulmonary vein is taking the oxygen from this alveoli, okay? So now we have the blood which is containing the oxygen, okay? And then this pulmonary vein, okay, will take this blood, oxygenated blood, and move it, okay, into the, or transfer this oxygenated blood into the heart. And then the heart will pump this blood into our organs, okay? While the deoxygenated blood, okay, which is coming from the pulmonary artery, okay, as we mentioned before, we have the blood which is deoxygenated blood coming from the heart, okay, through the pulmonary artery, and this deoxygenated blood, okay, it will lift this carbon dioxide into the alveoli, and when we exhale the air, okay, this carbon dioxide, okay, this carbon dioxide will move, okay, outside of the body, okay? So this is the process which is happening here in the alveoli, the gas exchange. Okay, so here also we have a muscle here. It's called basically the diaphragm. This diaphragm is separated the thoracic cavity from the abdominal cavity, okay? And what is the function of the diaphragm? The diaphragm basically it helps us in two important process. It in the inhalation and exhalation. So basically during the inhalation, when we inhaled the air, okay, this diaphragm it will contract and move to the down, okay? When this diaphragm is moved to the down, it basically reduce the pressure on the lung. So the lung it will move, the muscles of the lung also contract and moving outside, and this reduce the pressure of the lung, and the air basically will enter to the both lungs, okay? This is during the inhalation. But during the exhalation, what will happen, this diaphragm it will return to the normal position. So this is the normal position of the diaphragm, okay? This is the normal position. It will move to the up, and this position called the relaxation. So the diaphragm will relax, and this will increase the pressure into the lung, and the air can move outside of the body, okay? So it will move from the lung to the trachea, larynx, pharynx, and then move outside of the nose and mouth, okay? Okay, guys, so to sum up everything, firstly, we have the diaphragm. The diaphragm, as I mentioned, it's the muscles which is separated, the two parts, the thoracic cavity and then abdominal cavity. And then we mentioned and we described the parts of the respiratory system, the nose, mouth, the nasal cavity, oral cavity, the pharynx, larynx, epiglottis, and also we discussed the trachea, alveoli, okay, discuss everything. And then we discuss how the gas exchange it happened in the alveoli, okay? And we mentioned that the alveoli, the gas exchange it happened there. The oxygen it will move to the blood through the pulmonary vein, and the deoxygenated blood it will move from the pulmonary artery to the alveoli, the carbon dioxide, and we exhale it outside of the body. And also we mentioned that the right lung it's basically much more bigger than the left one, because here we have the heart located here.